Tetrahydrozoline is a decongestant that helps reduce redness in the eyes caused by minor irritations like smog, swimming, dust, or smoke. It belongs to a class of drugs known as sympathomimetic amines, and it works by temporarily narrowing the blood vessels in the eye. Some brands of tetrahydrozoline eye drops may also contain lubricants, which can help protect the eyes from further irritation and dryness. It is recommended to use this medication as directed by your doctor or pharmacist. Typically, the daily dosage is 1 to 2 drops in the affected eyes every 4 to 6 hours. The best time to take this medication is when you experience redness or irritation in the eyes. When using eye drops, make sure to follow the instructions on the package or as directed by your doctor. Always wash your hands before applying the drops and avoid touching the dropper tip to prevent contamination. Remove contact lenses before using the drops and wait at least 10 minutes before reinserting them. Check the eye drops visually before using them and do not use if the liquid has changed color or appears cloudy. Keep the medication out of reach of children and pets. You can use the eye drops up to 4 times a day as needed or as directed by your doctor. Tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Place 1 drop into the pouch and gently close your eyes for 1 to 2 minutes. Avoid blinking and do not rub the eye. If you need to use more than 1 drop, repeat the steps for each drop and for the other eye if directed. After using the eye drops, do not rinse the dropper and replace the cap tightly. If you are using other eye medications, wait at least 5 minutes before applying them, and use the eye drops before eye ointments. Using the eye drops for more than 3 to 4 days at a time may result in increased eye redness. If this happens, consult your doctor. If your condition does not improve after 72 hours or gets worse, stop using the medication and seek medical help. Some common side effects of using eye drops 0.05% to 0.25% include stinging or redness in the eye, widened pupils, or blurred vision. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist. However, it's important to note that many people using this medication do not experience serious side effects. If your doctor has prescribed this medication, they have determined that the benefits outweigh the risk of side effects. In some cases, serious side effects may occur, such as eye pain, worsening redness, itching or swelling in or around the eyes, other vision problems, shakiness, fast or irregular heartbeat, headache, sweating, weakness, or nervousness. It is important to inform your doctor immediately if you experience any of these serious side effects. While rare, a very serious allergic reaction to this drug may occur. Seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to remember that this is not a complete list of possible side effects, so if you notice any other effects not listed here, be sure to contact your doctor or pharmacist. As always, it's important to consult your doctor for medical advice about side effects. In the US, you may report side effects to the FDA, and in Canada, you may report them to Health Canada. Before using eye drops containing tetrahydrozoline, it's important to let your doctor or pharmacist know if you are allergic to it or if you have any other allergies. This product may also contain inactive ingredients that can cause allergic reactions or other problems, so it's best to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have glaucoma, heart problems, high blood pressure, diabetes, eye infection or injury, or an overactive thyroid. After applying the eye drops, your vision may become temporarily blurred. It's best to avoid driving, using machinery, or doing any activity that requires clear vision until your vision has returned to normal. If you are pregnant, you should only use this medication when clearly needed and after discussing the risks and benefits with your doctor. It's not known if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. When using eye drops 0.05% to 0.25%, it is important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It is not possible to list all potential drug interactions, so it is important to keep a comprehensive list of all medications and herbal products you are using and share it with your doctor and pharmacist. It is crucial to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of eye drops 0.05% to 0.25%. If this medication is accidentally swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or having difficulty breathing, it's important to call 911 for emergency help. Otherwise, contact a poison control center immediately. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include drowsiness, excessive sweating, decreased body temperature, and slow or shallow breathing. It's important to take the appropriate dosage and seek medical help if necessary. If you are experiencing symptoms of allergies, it's important to identify and avoid the allergens that may be causing your symptoms. Common allergens include pollen, grasses, weeds, dust mites, and pet dander. If your doctor has prescribed this medication for you to use on a regular basis and you happen to miss a dose, simply take it as soon as you remember. But if it's almost time for your next scheduled dose, then it's best to just skip the missed dose and continue with your regular dosing schedule. It's important not to take a double dose in order to make up for the missed one. As always, it's best to follow your doctor's specific instructions regarding the use of this medication. When storing eye drops 0.05% to 0.25%, it's important to keep them at room temperature and away from light. It's crucial to keep all medications out of reach of children and pets to prevent accidental ingestion. When it comes to disposing of the product, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, it should be properly discarded when it is expired or no longer needed. If you're unsure about how to dispose of the product, it's best to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.